Everyone needs labs. How much, how often? It's depending on who you are. I would say that if you're on testosterone, not to mention steroids, or if you're just really into your health, you need to understand your labs at least every 6 months, maybe 4 months, and some things certainly can be done like a PSA once a year, if everything's cool. Now, today I'm going to show you exactly how I maintain my perfect labs, guys. It's a lot of work, and it's never going to be do exactly what I do. You have to understand your fingerprints and exactly how to do this yourself with your diet, your exercise, and depending on your medical background with your healthcare providers. That's what I'm doing here now for you guys. Now, you can get these exact same labs that I negotiated a discount for you guys from a lab provider that uses Quest and LabCorp. For an example, the Anabolic Doc lab panel called General Health is $158. And that's with my link in the description of this video. It covers everything that I'm going to review today for you guys. Kind of primary care soup to nuts. You don't need insurance. You don't really even want to use your insurance sometimes because you may get charged a lot more. So for these labs, they're bare bones, super cheap. You need to use them. You don't even need a doctor's prescription. Okay, let's get right into my labs right here. We're going to start off, as I do, with the ABCDs. You want to learn more about this? You could see the video that I did prior, ABCDs. Now, that first ABCs, that glycemic index, blood pressure and cholesterol, cardiac, those are the 3 basic tenets that lead to heart disease. I do my labs every 6 months for my doctor or for myself and to make great videos. So I'm going to show you the truth. I couldn't believe I was disappointed. It went up to 5.5%. Typically it's 5.1%. It's under 5.7, so it's still normal. But if you're 5.7, you're pre-diabetic. Maybe close to 50% of Americans are nearing or are pre-diabetic. You need to look at your fasting glucose on a comprehensive metabolic panel, like I did right here, and then the hemoglobin A1C. It's very simple. Thank God my glucose is 82 milligrams per deciliter. That's in the 80s. So after 12 hours of fasting, my body, my pancreas with my beta cells, my tyrosine kinase receptors, with my liver, with my diet, my exercise, all the medicines I'm on, including a statin, which I'll talk about, my fasting sugar is in the 80s. That's acutely perfect. It's an acute 12 hours. Now, my 24/7 A1C went up. I should be down to 5.1. Here's what happened. Number one, I gained some weight, even 7 or 8 pounds. I'm living close to 200 because I want to bench at 198 because I love my life. I eat pizza. I drink wine every night. I take metformin 750. I take 1 tablet a night. I'm going to talk about what my approach is going to be. And I take rosuvastatin, a statin for my heart, protect me. I take 10 milligrams every other day so it doesn't affect the pre-diabetes and the diabetic impairment on glycemic index. When you look at statins, it's part of the there's good and bad on this stuff, and also the muscle effects on statins. But again, most of the stuff is overblown, guys. You can take statins, but when you're guys like us and you're really focused on muscles and feeling great, there's going to be just a suggestion of being on a statin. We know from studies, people feel brain foggy, they feel lethargic, they have muscle aches, and not to mention you could push this impaired fasting glucose state. I'm almost up to it, but I'm older. I'm almost 60. Things break as you get older. So what's my plan on this? What's my plan? Try to get back down a few more pounds, guys, but I have I have body dysmorphia. I don't like to be light because I have that reverse anorexia since I've been a kid. That's why I did steroids, and that's how I am today. I'm honest and transparent. I'll try doing some more cardio. I'm working so hard. even the days go by, I'm like, shit, I have no time for cardio. Bullshit. I got to get out there and walk with Nurse Wendy. I got to ride my bike. I got to do some cardio, maybe in the morning. My goal is getting back down maybe to 195, even a few pounds. What am I going to do? I'm going to increase my metformin instead of one. I've been on metformin on and off for 20 years. I've been on twice a day. I've been on even 2,000 a day. A day, right. So, but I'm going to take my 750 ER and I'm going to take, instead of one at night, I'm going to take one in the morning. You want to consider the metformin if you're getting up towards pre-diabetic or you're pre-diabetic, but you want to work with your doctors, work on the app with our healthcare providers. Now, another tricky thing is I'm considering lowering my statin because statins can impair glucose. It might be playing a role, but if I lower my statin, I'll lose the effect on the C we're going to run for my cardiac protection. And the statins, I don't feel are impairing my muscles and causing any statin-induced myalgia. SIMS, it's called. You could see that. And another thing before we move on from the A is I did start rapamycin. I like rapamycin. It's a real mTOR medication, mTOR inhibitor like metformin, but they work on totally different mechanisms. But I like that because mTOR inhibition with rapamycin is really probably the closest chemical prevention we have for instituting caloric restriction. You could see the studies on that. Okay, let's go to B. B is blood pressure. Okay, now despite being heavier and I wasn't happy with my A1C, but I'm going to make a plan on how to come back after that, to tweak it back down, is my blood pressure, despite everything I've done with the pizza, the weight gain, the training hard, my blood pressure, as you see on the Instagram, I pop that every couple times a week, blood pressure remains perfect. Now, I'm almost 60. I've had hypertension my whole life, not to mention being on test and DECA on steroids and testosterone. Just testosterone itself can cause it. So I'm on telmisartan, 80 milligrams a day, and nebivolol, 20 milligrams a day. I love to break up these medications 1/3 in the morning and 2/3 at night. Let's keep going. Look, when we're under blood pressure, we got to look at the kidney. There's a condition called cardiovascular kidney metabolic syndrome. Kidney disease and heart disease are tied in intimately itself. So with the grace of God, look at my BUN and my creatinine and my estimated GFR are perfect. I'm over that estimated GFR of 60, and I don't have any impairments in my urinalysis. I did it last time, and I have no proteinuria. You want to check all this stuff. Watch all my videos in the app, more about the details on this. You can't understand enough of this. And I also want to show off that on the comprehensive metabolic panel here, with my kidney function, my liver function, and my ALT is perfect. Now, a lot of you are going to have elevated ALT. Is it muscle spillover, or is it not alcoholic fatty liver disease? Do you have an ALT isolated just yourself? Get these labs. And if you do, and if you're overweight and you see the triglycerides and the pre-diabetes, boom, you have fatty liver disease. And when you fact check this, you'd be like, wow, it's all tied in together. This is why you want to maintain being lean and eat the best you can. But guys, I'm not starving myself. I'm lean as I can be. I'm functional. I like to enjoy. At the end of the day, Nurse Wendy and I, it's like a party, right? We look forward to we exercise, we do everything, take care of the dogs, take care of everyone, and then I want to have my meal. I look forward to it. So I just I don't eat too much. But if I starve myself, these could be perfect. I'd be depressed. But I leave that to you guys. That's why I've created these ABCDs with medicines, always diet and exercise. But you have to focus in. This is the now and the future. Don't beat yourself up. This is chemical prophylaxis, medication prevention prophylaxis. It's very complex, but ABCDs, you're going to understand it. Let's move on to C. C stands for cardiac calcium score, echocardiogram, cardiovascular disease. Now, I have a history of having atherosclerosis, which is cardiac disease, on an elevated calcium score. Thank God my heart otherwise has never had any injury, no myocardial infarction, no heart failure, with the grace of God. My heart, my kidneys, guys, are my fear. And that's what's kept me not using so much steroids. But when I was young, you have tons of health reserve. But are you chewing into it, and is it going to cause heart disease or kidney disease? And is it going to be too late, and then you're going to be really depressed when you can't come back from, when you have irreversible heart and kidney disease? It's very depressing, guys. And look at me, I'm 60. I'm still training hard and loving life and showing you guys this stuff. Look at the video on how I reversed heart disease. My calcium score was inching up, and I employed over 4 years really aggressive measures with ABCDs, and I reversed 20% of a hard score. The calcium score, that's almost impossible to suck out that real hard atherosclerosis. You got to stabilize the soft plaque. Everyone knows that. But when you start taking statins and start working on these things, the paradox is the calcium score goes up because it calcifies and stabilizes soft plaque into hard plaque, but the score goes up. I didn't like that. So I took the whole score down, which is called delipification. Watch the video, How to Reverse Heart Disease with Dr. Nolan. Now, my total cholesterol, guys, I'm at goal here. Check this out. Total cholesterol is 120, right? My HDL is 55 milligrams per deciliter. My LDL squeaked in at 49 milligrams per deciliter. My goal has been met. I want to be under 50. I have heart disease. However, I've never had an event. My goal for the lipid is to be under 50. I squeaked in at 49. Now, you need to understand your goals. I can guarantee you that your LDL is not at goal. And I know you don't want to just hear, just do the diet and exercise and take a statin. And I agree with you on that. So here's what I did. I took some statin because I wanted some pleiotropic effect on that endothelial tissue, guys. That's scientific stuff. It's protection. Statins are they're anti-inflammatory. They are protective. I just didn't want that much. Again, don't fill the baby with the bathwater. So I came up with a regimen from Dr. Paul Thompson, who's an amazing mentor of mine, cardiologist. He's a preventive cardiologist at Harvard Hospital. For years, decades, we've known you could take statins every other day. So I take rosuvastatin, 10 milligrams every other day, and I needed more horsepower with my diet and exercise. I ain't starving myself. I'm still going to drink a little wine. I'm still going to have some pizza. I want to stay 198 around this weight to bench and to be strong, right? Because I have this disease. I need that. So I do my cardio, but I added Repatha, PCSK9, to my regimen, and it substantially tanked my LDL. And I believe the most important piece to how I removed heart disease is right there, is getting my LDL down. Guys, please believe it. I'm not selling bullshit to you guys. The LDL, it's going to be too high. You're going to suffer from it. You got to understand the lipid physiology and the multifactorial nature of it. You got to understand. I added Vascepa, pharmaceutical grade fish oil, which is phenomenal. Reduce It trial shows that it protects. It's incredible, and it stabilizes endothelial atherosclerosis. I take a little baby aspirin too, of course, in this piece. Now, what can I do on that goal? Well, if I'm gonna, because of the A1C is a little high, and if I'm gonna back off on my statin, what am my LDL is gonna go up, guaranteed. And remember, I'm not starving myself anymore. I'm not cutting back on the wine. I do my 1 or 2 a night. Thank God I'm stable on that. And I ain't cutting back on my pizza. Maybe I will, but it's not going to lower. That's not going to lower my LDL to get it to where it is. So I would, if I cut back on the statin, I'm going to supplant that with adding either Zadia. Guys, Synergy is key, or bempedoic acid. This is an alternative now to people that are intolerant to statins for the statin-induced myalgia or the brain fog or any aspect of intolerance to statins. You could add them to low-dose statins, you need to understand the intensity of the statin. Synergy, guys, is key. Synergy in this medical world means you don't take one medicine and ramp it to the top anymore and then start adding medicines. It doesn't work. There's severe side effects on that. People are not compliant. You want to feel, I take my medicines because it's like I'm a highly trained athlete on all these are PEDs to me. I don't take them because it makes me feel like shit. I take them, it makes me feel better, and including sexually, nitric oxide, and performance. So you want to do this stuff. You just need to figure out your way, but your ABCDs are going to be mandatory for everyone. You keep those ABCDs perfect, with the grace of God, you're not going to have die from a heart attack, or if you have heart disease, you're going to stabilize it. Last piece on the C is my even though I'm some statin, my liver function. You see that? The LFTs, look at those LFTs on the medicines I'm on. You see, you look at that, 17 and 18 respectively for ALT and AST. And again, like on the A, if your ALT is elevated and you've identified it's not this, it's not all these medical issues, it's not drugs or alcohol or even muscle spillover, because it can be contaminating. It's not liver, but it's from muscle spillover. You're training hard. Doctors have to understand this. It's very complex. It's a differential diagnosis of exclusion than if you have to work up an isolated, elevated ALT on liver enzymes and you're overweight, you have fatty liver disease. Okay, let's move on to D. This is deposition disease. This is super complex specialty of internal medicine called hematology on androgens. This is where you take androgens, like me, like you guys, and from steroids and even TRT, and those red blood cells go up on the CBC, and then you have to look at the corresponding iron studies. Let's look at my CBC. Now, my CBC is my hemoglobin 16.9 grams per deciliter, so this is stable for me. Right, this has always been like this. It's been great. My hematocrit says 51.2. It says elevated, but this is not the true reference range here. The true reference range is 18 for the grams per deciliter for the hemoglobin and 54% for the hematocrit. It doesn't mean you need to use the whole bandwidth, guys. And you have to understand your health history. Have you had blood clots? I haven't. Heart disease. Are you living in elevation? Do you smoke? Are you on multiple androgens like Test and Deca? I love Test and Deca back in the day, but my levels were high. I had to phlebotomize. And a lot of you guys are over phlebotomizing. You're throwing the baby with the bathwater. Again, on D, you're throwing all your iron out. You need to look at the iron. Again, get these labs. Go to my link and get these labs for dirt cheap for you guys. You know, and what else can you do besides keeping the androgens down? It's a multifactorial issue, this androgen-induced erythrocytosis. It's not polycythemia vera, and you're going to learn that in the thick blood video. Educate your doctors and healthcare providers. Show them my thick blood video. Show them this video. I like curcumin. I like nattokinase and green tea, and I like telmisartan. Telmisartan for my blood pressure and protecting my kidneys and my heart. Also, I like the effect with nebivolol and nitric oxide for my pumps and for my sexual function with the erections are phenomenal with these medicines. Telmisartan has a side effect profile of slowing down erythrocytosis. We saw that years ago that it was a problem for people that were anemic, but I thought, whoa, we could use this because we're the opposite of anemic. We're polycythemic potentially. So telmisartan on D is a real big secret. Watch that thick blood video. Lastly, S. S stands for screening. It stands for skin screening, prostate screening, and here's where it is here. My PSA is 2.13. With the grace of God, for me, almost 60. It's been there before. It's never been higher than this. It goes like this. I don't have prostate cancer in my family, in the men in my family. Guys, listen to this. And I do have my doctor that prescribes testosterone to me is a urologist. He checks my prostate. He's even checked every year an ultrasounds in my kidneys with a full bladder. He can get a window on the prostate and my pelvis, and he could look at things. It's not perfect, it's not an MRI, but there's no need for me to have an MRI. Okay, you got to look at your prostate. Especially if you're on androgens and you're around 40, 35 to 40, including African American men, they have an increased risk for prostate cancer. See your doctors on that. Now, the S beyond screening and skin screening and sex, I call it, that's depression screening and sex. Colon cancer screening. If you have any heartburn, it's upper GI, it's heartburn, you want to really screen for this. Now, lastly, guys, my testosterone. So my doctor gives me what I give most of my patients. I talked him into it because he sees it works. It's the right dose and frequency. I take testosterone cypionate. It's dosed at 200 milligrams per milliliter. I take 0.5 milliliters every 5 days, and my testosterone came in just before the nadir. The way it worked out with the way I had to go to the lab for the appointment, it was 1 day early. So the total testosterone is only 753. Here's how dynamic. But my free is elevated beyond this upper limit normal of a reference range for a man who's not on esters. You're going to see mine's 268.8 picogram per mil, and my estrogen is slightly elevated in the 40s just before the nadir, but that's great for me. Don't treat these numbers on paper, guys. Treat you together. So I really hope you guys like this video. Again, this is my 60th year of life. I am so humbled to be healthy. I do everything I can with diet and exercise and great supplements and meditation, and I think just good karma. But I've created really for you guys these A, B, C, D, S's. The Anabolic Doc app is going to be new. It's going to be out very soon. It's going to be Testosteronology. You're going to have a dashboard where we're going to allow you to really have your own compendium, your own dashboard to manage your ABCDs with your healthcare providers that we're going to be training as well. Please, guys, give us a lot of comments. If you don't understand anything, give a comment. Try to get back to this. I'll try to answer as many as I can. And I want to see you guys really taking care of your health, organized with ABCDs. Thank you so much.